Introduction to Cognitive Behavioral Therapy, CBT. Defining CBT. Cognitive Behavioral Therapy, CBT, is a form of talk therapy that focuses on the connection between thoughts, feelings, and behaviors. It is based on the idea that our thoughts, beliefs, and attitudes can affect our emotions and actions. CBT is a short-term, goal-oriented therapy that is typically done in 12 to 20 sessions. It is a form of psychotherapy that has been scientifically tested and found to be effective in treating a wide range of mental health conditions, including anxiety, depression, post-traumatic stress disorder, PTSD, and obsessive-compulsive disorder, OCD. CBT works by helping individuals to identify and change negative thoughts, beliefs, and attitudes that are causing emotional distress. This is done through a variety of techniques, such as cognitive restructuring, exposure therapy, and mindfulness. The therapist and the client work together to identify and challenge negative thoughts and beliefs, and to develop new, more positive and realistic ways of thinking. CBT is a collaborative process between the therapist and the client. The therapist helps the client to identify patterns of thinking, feeling, and behaving that are causing problems, and to develop new coping strategies to deal with these problems. The therapist also provides support and guidance as the client works through the therapy process. CBT is a practical, problem-focused therapy that helps individuals to learn new skills and strategies for managing their mental health. It is not a one-size-fits-all approach, and it may not be appropriate for everyone. It is important that the therapy is provided by a trained professional, who can work with the client to develop a treatment plan that is tailored to their individual needs. How CBT works. CBT works by helping individuals to identify and change negative thoughts, beliefs, and attitudes that are causing emotional distress. It is based on the idea that our thoughts, beliefs, and attitudes can affect our emotions and actions. CBT is grounded in the cognitive model, which posits that psychological problems are caused by the interaction between our thoughts, feelings, and behaviors. The cognitive model suggests that negative thoughts and beliefs can lead to emotional distress and maladaptive behaviors. Therefore, CBT aims to change these negative thoughts and beliefs in order to improve emotional well-being and behavior. Cognitive restructuring is one of the key techniques used in CBT. It involves identifying and challenging negative thoughts and beliefs, and developing new, more positive and realistic ways of thinking. This helps the client to understand the connection between their thoughts and feelings, and to develop new coping strategies to deal with negative thoughts and emotions. Exposure therapy is another technique used in CBT. It involves gradually exposing the client to a feared object or situation, with the goal of reducing anxiety and fear. This can be done through in vivo exposure, where the client is directly exposed to the feared object or situation, or through imaginal exposure, where the client imagines the feared object or situation. Mindfulness, relaxation, and behavioral activation techniques are also used in CBT. Mindfulness helps the client to focus on the present moment and to accept their thoughts and feelings without judgment. Relaxation techniques such as deep breathing, progressive muscle relaxation, and yoga can help the client to reduce tension and stress. Behavioral activation techniques can help the client to increase their engagement in activities and to improve mood. The history of CBT and its origins. CBT has its origins in the work of several key figures in the field of psychology and psychiatry. The development of CBT can be traced back to the 1950s and 1960s, with the work of Aaron Beck and Albert Ellis being particularly influential. Aaron Beck, a psychiatrist, is considered the founder of cognitive therapy. He developed cognitive therapy as a treatment for depression and anxiety, based on the idea that negative thoughts and beliefs can lead to emotional distress. Beck's work focused on identifying and challenging these negative thoughts and beliefs, and developing new, more positive and realistic ways of thinking. Albert Ellis, a psychologist, developed rational emotive behavior therapy, REBT, which is considered a precursor to CBT. REBT is based on the idea that our emotions and behaviors are the result of our beliefs and attitudes. Ellis developed techniques for identifying and challenging irrational beliefs, and for developing more rational and realistic ways of thinking. Cognitive therapy and REBT were later combined to form CBT, which emphasizes the importance of both cognitive and behavioral strategies in the treatment of mental health problems. The cognitive model posits that psychological problems are caused by the interaction between our thoughts, feelings, and behaviors. CBT aims to change these negative thoughts and beliefs in order to improve emotional well-being and behavior. Over the years, CBT has been adapted to treat a wide range of mental health conditions. These include anxiety, depression, post-traumatic stress disorder, PTSD, and obsessive-compulsive disorder, OCD. It has been scientifically tested and found to be effective in treating these conditions. CBT is now widely used in both individual and group therapy settings, and it is also being integrated into other forms of treatment such as teletherapy and self-help programs. CBT is considered one of the most evidence-based forms of talk therapy and is recommended as a first-line treatment for several mental health disorders by various professional bodies.
That concludes part 1 of our mini-course. Please continue with this playlist to see the rest of the course.
Thanks for watching. Check out the video description below for some resources that can help with your mental health problems or journey. It would really help our channel if you would comment, like and subscribe.